A 33-year-old male presented with back pain and progressive dyspnea. I am showing you his chest radiograph. Describe the findings.
Right, so the chest radiograph demonstrates changes of upper zone fibrosis, including bilateral upper zone reticular opacities and elevation of both hilar. Crucially, there is a large cavity in the left upper zone containing a soft tissue density mass surrounded by an air crescent. There is also marked thoracic kyphosis, with the head obscuring the apices, and syndesmophyte formation along the thoracic spine.
What is the diagnosis, and how do you link these findings?
The combination of back pain, kyphosis, and syndesmophytes indicates ankylosing spondylitis. The upper lobe fibrosis is a known extra-articular manifestation. The cavitating left upper lobe lesion containing a soft tissue mass and air crescent represents a secondary mycetoma, or aspergillus fungus ball, developing within a pre-existing fibrotic cavity.
What is the differential diagnosis for upper zone predominant pulmonary fibrosis?
A useful mnemonic is STRAD, which stands for Sarcoidosis, Tuberculosis, radiation fibrosis, Ankylosing spondylitis, and dust inhalation, including silicosis or chronic extrinsic allergic alveolitis.
Let's review the cross-sectional findings. I am displaying an axial CT scan. This axial CT scan. Describe the findings.
This axial CT image demonstrates a cavitating lesion in the left upper lobe apical segment containing a soft tissue density mass surrounded by a crescent of air. This represents an aspergillus fungus ball, or mycetoma, which typically colonizes pre-existing apical cavities in patients with ankylosing spondylitis.
How would you manage this patient as a radiologist?
I would compare the chest radiograph with previous films to assess apical fibrocystic changes and movement of the intracavitary mass. I would ask the patient about any history of hemoptysis, which is a common and potentially life-threatening complication of a mycetoma. I would recommend a contrast-enhanced chest CT to evaluate the mycetoma, check for bronchial artery hypertrophy, and assess apical fibrosis. I would refer the patient to a respiratory specialist. If severe hemoptysis occurs, I would recommend immediate bronchial artery embolization or thoracic surgery referral.